You're listening to the Talking Air Filtration podcast, where you get to know the people that make air filtration possible and help us all breathe easier. Because clean air matters.
We'll get insights from air filtration professionals and learn how they became successful in their careers. Along the way, we will discuss best practices, guidelines, trends, and challenges in air filtration in a variety of applications. We hope HVAC, air filtration, and indoor air quality pros, including business development, engineering, building owners, and facilities management, will enjoy the insights our guests will bring to this podcast.
We got Kyle Megna joining us today from Air Things. He's going to help us understand the future of fresh air with his session of navigating post-pandemic changes in indoor air quality. Kyle Megna is an experienced professional in the indoor air quality arena, currently superheading initiatives as regional manager of the Western U.S. at Air Things, where he's recognized for a strategic approach to sales and enduring client rapport. Kyle's blend of engineering powers business insight and specialized experience with sensitive indoor environments uniquely positioned him to offer perspectives on indoor air quality challenges in post-pandemic world. Let's give it up here for Kyle.
All right, thank you. So as he said, I'm Kyle Megna. I'm the regional sales manager for Air Things. Very passionate about empowering people to breathe better. There's a lot going on in air quality post-pandemic, specifically with legislation and grants available and just the changes we've seen in the air overall. So how did we get here and where is here? Right now, we're seeing the most engagement in indoor air quality that we've seen since the 70s, so 50 years ago. Back then, it was mostly related to outdoor air, pollution, the environment, and they actually got a lot of changes done. So right now, the focus has shifted. We're focusing on indoor air now. So a couple of things that we learned, from the pandemic. We learned to stay 6 feet apart, learned to wear our masks, taught us to wash our hands, which we probably should have already known, and it taught us to clean some surfaces. We were told that would keep us safe. But it really didn't, right? People kept getting sick. You were staying 6 feet apart. There were still super spreader events. It really didn't do that much to mitigate the risk. So what we found, and the example I'm going to use here is I have a bunch of newborns at home and a bunch of kids. So if you think about a toddler, you see them sneeze. They're obviously not covering it up. The spray goes everywhere, but it falls to the ground. So the thought was, great. Droplets fall out of the air, we wipe it up, everyone's good. But that wasn't the case. The virus was hooking onto droplets that were much smaller, and they were spreading hundreds of feet. And if there was low humidity, if there were any other issues with the ventilation rates in an area, it was staying in there for hours. So basically what that looks like is if you think about, okay, social distancing happened, we were finally allowed back out in public, and you go to a coffee shop. You're staying 6 feet apart. There's about 30 people in that room. Think you're safe. But if the ventilation rates were bad, then it was about the same as if you were taking a big drink out of a coffee cup filled with everyone's respiratory backwash. Delicious, right? Or you can think of it as every 30 breaths that you were taking, you were kissing every other person in that room. So again, delicious. 3% of the air you were breathing is coming directly out of someone else's mouth. So if we take that and we look at this room, you look left, you look right, you guys aren't 6 feet apart. It's the same as if there's poor ventilation. It's the same as if you were chugging down a Stanley Cup of everyone's respiratory backwash. Oh, yeah, I can't speak to what's happening at the after hours NAFA. I don't really want to be sharing a kiss with all of you. And so I set up a monitor just to see where we were at and how many of you feel like the air quality in here is probably good? No, a little cold maybe, around 64 degrees. That's probably the only thing really keeping you awake because CO2 is up around 2,000 parts per million. Particulate matter is around 20, so we're not breathing great air right now. It may come as a surprise to you, all this on air quality. Probably not. I don't think it would be that surprising that everyone's awareness around indoor air quality has risen exponentially since the pandemic. One of the company statistics I want to go into is a company called Aerated out of the UK. They specialize in forensic indoor air quality analysis, so spraying some molecules into the air, really finding root cause on what's going on. But they put out a survey every year on awareness around the actual indoor air quality. And it's risen a lot. In 2021, 73% of people said that their awareness had improved. And it's actually improving more in the US than in Europe and the UK in general. 80% in the US said that they had increased awareness. But even though awareness is increasing more here, less is being done about it. In Europe, you have all sorts of councils and legislation going into place, and they're actually a couple of years ahead of us on that. What is changing that a little bit was the push to get back in the office and going back from remote workers to actually getting into the office. So employees are pushing this. Everyone is much more concerned about what they're breathing because we know it can really hurt us. A huge push has come from the virus, but people are also becoming more aware of respiratory illnesses and everything else surrounding that. Where there's a gap is while employees want that difference and want indoor air quality monitoring and want to see changes in that, only 26% of employers are actually making a change or committing to make a change so far. A few things that are changing that are the current job market, right? Everyone's really trying to get their employees, having trouble with turnover, and so they're starting to come around to it, and that pressure is building to where changes are happening, but it's still not quite there. So again, the pressure is building, the opportunities are coming, the knowledge and the awareness is coming, but we're not quite there yet. So I want to go over, this is a standard distribution, a bell curve here. You may have seen this. It's pretty common for a model for tech adoption, kind of agnostically across the board. And so on the left, you have the people who are adopting it first. It's a very small percentage of people. The example I like to use is Tesla. So the innovators for Tesla would be the people that were driving around those cars in 2012, back when the stock was a couple of dollars, $2 up to maybe $5. So that was probably pre-pandemic for us in indoor air quality. Right now, we're in the early adopter phase. So you fast forward a few years from there for Tesla, you're talking about, instead of those early people and those probably a little more nerdy people who are actually getting into the electric cars and driving those, now you're looking at, the cool guys in California. There's a waiting list to get into these cars. It's really starting to pick up, but the majority of people aren't there yet. Where we're trying to get is to the top of that curve. That's where the market has fully adopted it. That's really where electric cars are now, where you've got the Kias, you've got the Hondas, everyone's driving one, and at the peak, if you got in late, Tesla shares were already up to $400, and now they're starting to decline. So it's a harder market to get into. There's more competition. Prices are being driven down. You don't want to wait, and you especially don't want to be a laggard. You don't want to be one of the last people adopting this. So the time is right now. And again, what we need to get there is really legislation. There's some legislation coming out now. We're going to go into that a little bit later on. But it's just not there yet. It doesn't really have the punitive effects. People aren't being forced to adopt it the way that it's going to take to get the majority of people on board. All right, so we talked a lot about the awareness and where that's going, but let's actually talk about the air quality a little bit. It's getting better, kinda, a little bit. Still have a long ways to go. 36% of Americans still live in a place with a failing grade for ozone and PM. 17 million less than last year, but it's still not great, and it really depends on who you are, where you live. That's the US in general, great. But if you look at big cities, you look at some of those areas, it's just not there yet. Another way you need to break it down is indoor versus outdoor. And then you need to look at the community that we're talking about. You need to take into account climate change and the time frame that you're looking at for if the air is actually getting better. And then we can talk about how green buildings are having an effect on our air quality as well. So when you look at outdoor air specifically, what you have to take into account is over the last 30 years, yeah, it's gotten better. Ozone, PM2.5, those levels are going in the right direction. But that's across the entire US. If you look at the metropolitan areas, those vulnerable communities who are living near freeways or industrial areas, factories, theirs getting exponentially worse. It's going in the wrong direction. And then if you shorten that timeline and you look at the last 5 years, it's also going in the wrong direction. And that's mostly due to the wildfires and the droughts that we're seeing. Those are coming in record numbers. So PM2.5 over the summer is completely taking that in the wrong direction. Indoor air, we're kind of seeing the opposite trend. Indoor air quality has actually been getting worse over the last 30 years. And that's largely driven actually by the efficiency in the green buildings movements. A lot of the green buildings and new construction have come at the expense of healthy buildings. So they're getting more airtight. There's less outdoor air coming in. It's heading in the wrong direction. That awareness is changing. All of that awareness and the movement is kind of heading in the other direction the last 5 years, where it's actually getting a little better in most areas.
Are your air filtration personnel NAFA certified? Ask if they belong to NAFA and have their certified air filter specialist or NAFA certified technician designations. The CAFS and NCT designations are earned after rigorous exams and demonstrate that the air filtration professional has a high degree of knowledge and professionalism. To learn more about NAFA certifications, visit nafahq.org.
There's a lot of public information on the outdoor air. It's the EPA, the American Lung Association. It's all out there. You can find it. The indoor air reporting is coming more from the private side. It's a lot of companies that have the data and are doing the monitoring. And then it's a lot of universities doing their research projects as well. I'm going to go into, this is some of the Air Things data that we have, but I want to touch on a little bit that we have on the big three, PM2.5, TVOCs, and then we'll go into the CO2. So Air Things publishes a report every year, and what we're seeing is overall indoor air is getting worse. If you look at PM2.5 being the main driving factor, it's 17% worse in the last year compared to the years before that. Again, wildfires, drought, that's all going into that, but just heading in the wrong direction. And that's what most of the air quality is being based on. If you look at TVOCs, it's heading in the other direction. It's 18% better than it was the year before. So some good news, a silver lining. And then a fun fact on that, the worst week we saw for TVOCs is the week after Thanksgiving, the week after Black Friday. Everyone's unpackaging those Christmas trees. You're getting all of the presents delivered in from Amazon. And there was actually a 6% spike in retail homes in TVOCs. So open your windows when you're unboxing everyone's presents. CO2, when it comes to in consumers' homes, it's getting way worse in the summer, where you're seeing time over threshold, which is the total time over about 1,000 parts per million, where you start to see headaches and fatigue and all of those come into play. The summers are way worse, and then it gets better in the winter. On the business side, it's a much flatter curve across the board, but it's actually getting worse. And part of that is that there's just more data available, more people are adopting it in the commercial space, and they haven't had as much time to correct it. But so this line will show year over year. Each color is a different year, and it's slightly getting worse each year when you look at the total between consumer and the business spaces. That's kind of it on the actual IAQ data. Now we're going to go into legislation a little bit and see what the man is doing to actually make a change on the air quality. At the federal level, the big man, he isn't doing too much yet. There's plenty of talk, there's plenty of PR initiatives, but there's no legislation yet. That may change, highly dependent on the election. But there's plenty of legislation coming into place at the state level. And their focus so far is mainly on schools. A couple of reasons behind that. One, it's low-hanging fruit. 41% of schools have outdated HVAC systems. Over 50% of those schools have poor air quality. It's highly visible, the effects of it. It's been studied the most in schools. It affects their attendance, which in turn affects their funding, and it affects their test scores, and then also it affects how well they're behaving for the teachers. So teachers' unions kind of care a little bit. So when it comes to states and legislation, you guys have seen this in HVAC, you've seen it in efficiency. California starts to set the trend. Not just in fashion, not just in movies, but when it comes to all the codes. California likes to set a very high bar, and then it trickles down and other states kind of make more realistic accommodations from there. So we're going to talk about California because it is very much the trendsetter and what you can expect to see in the next 10 years coming across the rest of the states. So they started in 2022 with a program called CalSHAPE. It's a grant opportunity related mostly to HVAC, and then there's some plumbing sides to it too. So far, they've released $182 million in funding to schools in the area. Right now, there's another $235 million available, and they're extending the timeline to 2030, and it's expected to reach $600 to $700 million in total when it's finished. So again, there's two parts to this. There's the HVAC side, which is broken into another three parts under that, where you have the assessment and maintenance track, you have a rip and replace track, and then you have schools that don't have any ventilation in place that are net new. And indoor air quality is tied to all three of those, and it's specifically CO2 monitoring. That's the only standard that they really care about so far. Funding's also being shifted away from the plumbing grant over to the HVAC side in the next year, which also has plenty of filter and all of those requirements, but I'm the IAQ guy, not the filter guy. So speaking to eligibility, and this is one where, we mentioned vulnerable communities earlier as the areas where IAQ is the worst. And so they took that into account. Primarily, the funding right now is going to those underserved communities. All of the schools will be eligible, but the majority that have seen any approval so far in those spaces. And that's defined by the 25% most disadvantaged part of the state, as defined from California's EPA. So it's, again, the areas near the freeways, the factories, all of the pollution. It's also low-income areas, so if they're making the household income is 80% or less of what the state average is, or if 75% of the students are eligible for free or reduced lunch rates. Those are the schools that are getting it. Even if a district has a mix of schools that are in and out of those areas, it's only the schools in those areas that are getting the funds. The bidding process is being dominated by the energy companies as well. They're from everything from consulting on the grant process to actually the ones who are bidding on it. If you want to get involved, it's going through the energy companies. All right, so talking specifically to IAQ, because the specifications that they're putting in their system are what we're going to see in most states, at least in some form or another. Their monitors, it has to be continuous monitoring. CO2 is the only thing they care about. It's hardwired or it's plugged in. Has to be 3 to 6 feet above the ground and 5 feet away from a door or a window. They set their threshold at 1,100 parts per million, which anything above 800 is less than ideal. Probably don't need to talk to you guys about that part. But so that's where they set their threshold. It needs to be able to provide notifications and alerts, and it has to have a display. This is where, if you work with facilities guys a lot, they probably don't want to see the display, but they've written it in so that the teachers have that right. And then there's some calibration and accuracy requirements, but that is the main part of it. Where California has fallen short is guidelines on what to do when it's exceeded. You have to have the CO2 monitoring installed to be able to get the grants and get the rest of the HVAC equipment and repairs. But there's not much on what happens when you actually exceed that threshold besides increased ventilation rates. And if they don't do that, there's no consequences at all. So as I said, other states are always going to follow the trend. And the other three that have actually made any progress are Colorado, Maryland, and Oregon. And I'll go into their legislation as well. And then you're also going to see a few cities on there making changes. And a lot of those are They're the cities you would expect. They're the ones that have made pledges, decarbonization, net zero, anything regarding the Paris Climate Accords. Those are the areas where this is starting to pop up. But as far as states, we'll start with Colorado. They also passed in 2022, Colorado Clean Air for Schools program. It did two things, and it was mostly just throwing money at an issue. They provided HEPA filters for schools through Carrier, and then they provided an IAQ monitoring solution, and they provided 2 years of subscription for that. So that program is actually expiring this year. What they didn't do was put any thresholds in place, any guidelines into what to do when you do cross one of those thresholds. They said, here's some money, you'll get some data, and good luck figuring out what to do with that data. So Maryland was the next one, again in 2022. Maryland, Colorado, and California all kind of came out right around the same time and just took different approaches. So Maryland, instead of doing continuous monitoring, they kept it to kind of a spot test where you need 2 days a year, where you need to have CO2 monitored in the classroom, one during the heating season, one during the cooling season, for an entire day. What they did well is they set a couple of different threshold levels. They separated it into the 1,200 to 2,000 parts per million area, the above 2,000. So they did a good job there. You know, it's a big difference between that 1,200 mark where you're starting to get headaches, fatigue, and your performance might not be as good, to where it's above 2,000 where you're starting to have migraine level headaches and much bigger issues. So they broke it into that. They gave some fairly good guidelines too into how you actually handle those issues, albeit a little misguided. So we're talking CO2 as the only thing that they're measuring, and a lot of their requirements were increased filtration, which I don't have to tell you guys that that's not really touching the CO2, it's just taking out the PM. So a little misguided, but they tried. And it does put things into place for if you're above that 2,000 level, you have, within 3 months, you have to put some temporary measures in place, whether that's just take a certain number of kids outside of the classroom and remove that, increase ventilation rates, increase outdoor air. And then within a year, you have to actually make permanent changes to fix that space. So that brings us to Oregon, which this is just going into place January 2024. This is the one that most closely is going to resemble California's requirements as far as the threshold, and you see some of the same things with where they have to be placed. It's 3 to 6 feet above the floor. It's 5 feet from a door and a window. Alerts have to be made available to teachers. Same thing, you can't hide your data. Has to have a display. Has some certain accuracy requirements. And they also tied it to grant funding. So if you're going to use state or federal money to improve your HVAC system, which a lot of the schools need to do, they have to implement CO2 monitoring. So that's in place. They have decent guidelines, and they changed how crossing that threshold works, where in other states, California and Maryland specifically, it can hit above that rate, and any amount of time above that threshold means they have to do mitigation. But if your HVAC system's working properly, you know, it might spike, but if it's drawing back down really quickly, it's not a huge issue. So Oregon kind of took that into play, where it has to be above the threshold for 15 minutes, and it has to do that 4 times a year before it actually has any meaning. And then you have to have an HVAC assessment done by an engineer, and there's a whole process for actually making change. So these are just a few of those hotbeds where there's no legislation, but New York City and Chicago, specifically as it relates to the school districts, are making changes. And Utah just received $750,000 in grant money to address it, which I don't know how many of you are familiar with Utah, but it's surprisingly bad air with their inversion and all that good stuff. So for the states that don't have anything yet, we expect to see a lot of what California has brought to the table. But Johns Hopkins has also been putting together a lot of press releases and a lot of campaigns. And one of the things they put together is the Model Air Act, which is basically just what it says. They have a template for bringing this to legislation. So if you don't have anything in your states, you're worried about what that's going to look like, this is kind of where a lot of that is stemming from. All right, so we're going to shift a little bit, talk a little bit about the money that's coming in and where people are funding these. So ESSER, Renew, and the Inflation Reduction Act are the main three that we're going to talk about for grant funding right now. And then we'll get a little bit into the certifications for LEED and WELL, because there's a couple of changes coming there as well. So ESSER is basically the blank check. This is the government throwing money again at the pandemic and helping schools prepare for that. It came in everything from HVAC repairs to getting computers and things like that. So the third round of this is currently underway. There's $122 billion in funds still available. Originally, like a couple of months ago, schools were actually worried about being able to spend all of the money, which, shocker, they figured it out. They're not going to have any issues there. But there are still RFPs out there, and people are scrambling because they have to have them committed by September 30th of this year. All right, so Renew is the next one. This is Department of Energy, and it's a little more restrictive because it's mostly tied to energy efficiency. But because IAQ monitoring goes hand in hand with that, and you can look at things like occupancy and light usage, and you can increase energy efficiency through IAQ and do things like demand control ventilation. It can be built into these. It just has to be a little more purposeful, and you have to have a little more intent when you go into that process. There is $500 million in funding still available, and they're doing submissions for the next round right now. This is the most current one. They actually just closed applications for this. It was in March. They extended it to April. But again, so this is ongoing. They haven't awarded that yet. They plan to award it in October. But so it'll be groupings of $5 to $8 million per grant, $32 million in total. And this is covering everything from research to actually getting IAQ monitoring in place. This is the first one that we're seeing where PM 2.5 is the focus instead of CO2. So that is kind of the next level too. That's kind of what we expect to see in California next, is them shifting from the CO2 monitoring to that PM 2.5 and the VOCs as we move forward. And we think this is kind of be the first part that drives that home. All right, so we're going to go into the building certifications now. LEED is it's the one that everyone knows. You guys have probably worked on LEED projects before. This is also part of what was driving those green building standards and that energy efficiency that was leading to poor indoor air quality and poor IAQ in general. They're starting to shift that. Coming this next year, they're implementing continuous monitoring on IAQ as part of their certification program. So where previously they were just doing spot testing and you could get about 3 points towards your certification, that's going up to 10 points now. So it'll be a much bigger chunk. We expect architects and designers to actually start taking notice of the IAQ monitoring as an opportunity here. The other side of this is WELL, which WELL was kind of the stepchild of LEED. It came about directly because of it. WELL focuses on the building overall, and not just IAQ, but IEQ, where the entire environment's coming into play. And it involves everything from bike racks and green spaces to actually worrying about the IAQ in a space and making sure lighting's right. And so it's a much more holistic approach. And one of the things you can see is, so this graph shows the square footage of WELL projects, and it has skyrocketed since 2019. And so this was initially much bigger in Europe, but we're starting to see it, especially in the epicenters like LA, Chicago, New York. This is really starting to pick up. And another area where the IAQ monitoring is taken into account. So we talked a lot about schools and that side of things. I want to briefly touch on what we're seeing from the commercial side of things. The people that are starting to take notice are large tech companies, Fortune 100 type clients, as well as high-end architect firms and designers. And it's usually where you have the high dollar employees, where productivity is really affected, that class A real estate, that kind of things. Like Amazon is one of the biggest that have recently adopted this kind of thing. So it's starting to come into that space, but it's like if you look at a list of top places to work, it's the startups that are really trying to find new and innovative ways to bring people on board, and IAQ is one of those spaces. So we're just going to go through some of the market trends, legislation being the big one. We've seen it a ton in schools, at least in 4 states so far. So schools, that's going to expand. We're also starting to see it be talked about in correctional facilities and prisons and being legislated into prisoner rights. That's kind of the next area we see with that. Grants and funding, ESSER being the big one. There's a ton of leftover funds from pandemic era projects that are still being used up this year and in the next couple of years. And the EPA is starting to fund those projects towards PM 2.5. Private sector, it's mostly those tech giants and people that have those high dollar employees. You're also starting to see on the building certification side, they're realizing, building owners and building tenants are realizing they can charge more for rent if they include it, up to 10%, up to a 10% premium. And the big one is we're seeing integrations and data-driven decisions. So it's not just IAQ, it's being tied in with everything from like fall sensors and heart rate monitors in the consumer space to leak detection and the water things and lighting. And it's also being used more on the control side with the demand-based ventilation in those areas. So it's integrating everything together, putting it in one place. And they're getting better about really boiling down the data and letting people make decisions with it. That's kind of the next step. We've been throwing data at people for years. The next question is, what do we do with it? And so that's where things are going. There's a lot of AI and a lot of insights actually being generated because the people who were receiving the data really didn't know what to do with it. They weren't tech savvy. They weren't people who really knew what they were looking at all. So those are the next steps. And that is where we're at now. So if you guys have any questions, I'm here for you.
Are you seeing an elevation or an increase in buildings doing reset or using reset?
There are, and it's being incorporated a lot more on the data side, making sure that things are accredited and aligned with that. It's a lot of those certifications are being combined and partnered together, is what we're seeing. Mm-hmm. But this year, so far, we haven't seen any reset projects on our end.
No. So LEED and WELL are 1 and 2 and reset be way down?
Yeah.
Just another quick one. The amount of money that's available in grant money right now is unbelievable. Yes. Do you have a breakdown of where the money is being used? You mentioned even computers, but how about replacement of aged HVAC equipment?
Yeah, so the California one is probably the most representative, where $182 million has gone directly into those HVAC systems. I don't have the exact breakdown of ESSER or where those are going.
Mm-hmm. Well, still a lot of money spent.
Yeah.
Thank you. So when you were talking about CO2 reduction, was that carbon footprint reduction as it is with LEED and so on, or was it CO2 as in indoor air quality?
Yeah, so indoor air quality, that's the level of CO2 that you're seeing in the classrooms. So each monitor is being deployed in an active classroom. They're not really worried about hallways or communal spaces. It's just in the classroom right now.
So the grants aren't necessarily to reduce your carbon footprint then, it's strictly from a...
No.
Got it.
No,
okay.
Yeah, it's completely separate from decarbonization and all of that.
Cool, thank you.
Yeah.
Getting back to the CO2, like if you're monitoring it, I've done a lot of monitoring CO2 back in the day, especially in schools that were 1,800, 2,200 and that. If the numbers are elevated, say in that range, there's really no action plan to increase ventilation, open windows, get people out of the room, or?
Yeah, so that's a huge part of the problem, right? Because schools, unfortunately, a lot of them aren't allowed to open the windows at this point because of active shooters and those kinds of issues. So that's being taken away in a lot of districts. So you really are kind of left with increasing the amount of outdoor air coming in through the ventilation systems or changing how the spaces are being used in general. There's a few things out there, like there's some experimental stuff with like algae. Instead of using like a HEPA filter and a portable filter that way, they're using an algae-based one where it's so house plants, right? They pull CO2 out of the air, but you can't pack enough of them into a space. So it's making a highly concentrated version of that is kind of an attempt to address it, but really it's all the high dollar HVAC replacements and
collecting data, I guess, right now.
Yeah.
Yeah. Okay. All right.
Thanks, guys.
Thank you, Kyle.
Thank you.
Thanks for listening to the Talking Air Filtration podcast, a production of the National Air Filtration Association. Clean air matters.